Hi, this is Dr. Centrell Psych. I'm an adult psychiatrist with a focus on addiction who helps those with psychiatric illnesses and addiction find a pathway to recovery. Go to www.facebook.com/Dr. DrCyntrell Psych to follow me. Today I'm talking about opioid crisis and babies. Today we will talk about pregnancy and opiate addiction. These days, we cannot turn on the TV or get away from the news about the opioid crisis in the U.S. We can find that research has found that over 2 million Americans are addicted to opiates, and over the last 15 years, overdose deaths have increased 4 times. So when I deal with my addicted patients or patients who suffer from addiction, we oftentimes talk about the stigma that they have to face, the fears they have, also their withdrawal symptoms, and actually being punished for their use. Another topic that comes up with these clients or patients is that, most of them have children, or most of them are in childbearing ages. So what if there's a woman, what if they get pregnant? Will they have the resources they need to continue on with their treatment, or will people stigmatize them for being on the medication they're currently using to get off of their opiates? So this series discusses the opioid crisis and their children, starting with infants. So in the U.S., every 19 minutes, a baby is born with an opiate addiction. I actually don't like a baby is born with an opiate. What we call them is an opiate addicted baby. I actually don't like that term too much, because the baby is mostly exposed to opiates during their prenatal period. They're not addicted because addiction involves a person continuing use of a substance despite harm, and the baby won't be continuing use after the neonatal period. So let's discuss. So what are opiates? I recently was watching TV and a lady said, well, I didn't even know that was an opiate. And I was like, that's interesting. So what is opiate? It's usually prescribed by a physician for pain management. So some of the names of opiates that are prescribed are codeine. These are the generic terms for them. Codeine, morphine, oxycodone, hydrocodone, meperidine, tramadol. Also, for long-acting opiates, usually used to treat opiate addiction, is methadone and buprenorphine. Opiates can also be found in cough syrups, so you can also ask your doctor if he or she is prescribing you an opiate in your cough syrup. The legal term for opiate, or the legal drug for an opiate, is heroin. You find those on the streets. Another more common or more frequently found for me is fentanyl. In overdose patients, is fentanyl. People are using fentanyl on the streets now. They're usually lacing it. It's just pretty much mixing it with heroin or cocaine, and that's actually a very, very dangerous combination. So let's go back to opiates use. So opiates are highly addictive, meaning that you can easily form an addiction to the drug. So besides relieving you from pain, opiates can cause you to have a feeling of calmness and happiness, which I call euphoria, which makes it more likely for you to become addicted to the substance. So, like other addictive substances, so you start to use, then you start losing control of that use, and then you have poor ability to stop using it, even if you have consequences such as legal issues or potential for overdose. Like, you just continue to use, but you're having all these issues in your life that you're no longer in control of, and that can be a problem. So drugs and pregnancy. So whatever you use when you're pregnant, your baby will also use. So there's actually, in research, no amount of substance like drugs or alcohol that you can use that's safe for your baby. So any mother expecting should discontinue or try to find a way to stop using the drug. We'll get back to that a little later. I don't want you just to abruptly stop using any drug, but we'll talk about that a little bit. So opiate and pregnancy. So if you use opiates during your pregnancy, you can have severe consequences for your baby. So what are the consequences? Some of them, I'm not going to tell you all, but premature birth, miscarriages. Also, if your baby is born and you are using opiates during the pregnancy, the baby can get what we call drug withdrawal, which we call neonatal abstinence syndrome. So what is neonatal abstinence syndrome? So it's pretty much caused by exposure to opiates while the baby's in your uterus. So when the baby comes out, the baby will likely experience, no matter what, experience diarrhea. They'll be very excessive crying. They will be sucking more. Also, if you check their muscles, they'll have increased muscle tones. Sometimes they can have the tremors. Also, they'll be a lot more irritable than a baby not born with the neonatal abstinence syndrome. They'll have poor feeding and actually have difficulty gaining weight during that period. Also, some of them have severe problems with breathing, depending on how much opiates you use during the pregnancy. So how do we treat these babies? So usually, I don't treat the babies because I'm a psychiatrist, but I'll tell you the treatment that is usually used during when the baby's in a NICU, which is a neonatal intensive care unit. It's mostly comfort care. So they reduce the noise that your baby experiences. They swallow them, which is pretty much wrapping them in a blanket really tight so that they feel warm and cuddled. Also, they feed the baby because, like I said, they have low birth weight. Also, they would give the baby something that was similar to the drug you used and try to wean them off them, meaning that they give it to them at a certain dose and then try to decrease that amount so that the baby can come off of the drug safely. Also, during this period, you most likely be away from your baby for days to weeks because the baby will be in the hospital for an extended period of time. So let's talk about if you have an opiate use disorder or if you have an opiate use problem. So what does that look like? So this can look in two different ways. So you can have a problem. You can have a problem where you're using opiates in an improper way, like you're not prescribed a drug, or you're prescribed a drug but you're taking too much. So you can have cravings. Also, you can have problems in your life such as legal issues or loss of job or any other type of problems that will be associated with that particular drug use. Also, there's women who are actually prescribed a drug by a physician prior to knowledge of their pregnancy. So either way, all of that has to be dealt with. So it is not safe, like I said before when I was talking about that it's not safe to use drug or alcohol during pregnancy, but it's also not safe to abruptly stop or just suddenly stop, go cold turkey from drugs or alcohol during your pregnancy, because that can cause big problems for your baby and you. So with opiates, one of the problems that you can have, or some of the problems that you can have, is that you can have placenta abruption, which is when your placenta detaches from your uterus, and that can cause you to have heavy bleeding, which can be life-threatening for you and your baby. Also, if you just stop abruptly, you can have premature birth. Also, you can have death of your baby. And also, withdrawal symptoms, which you won't be able to, which will be you and your baby withdrawing from the drug that you were exposed to. So what can you do? So my biggest thing, and I know some people are fearful of this, is to talk to your provider. Talk to your psychiatrist, talk to your OB-GYN, and then get yourself into treatment. So what type of treatment is available for you as a pregnant woman who's also an opiate, have been exposed to opiates, whether you're opioid user or you're prescribed. So either you can get a taper, or also there's medically assisted treatment for opiate, which is we'll use a long-acting opiate such as methadone or buprenorphine to help you reduce your cravings and also have you on like a safer, more manageable dose where you're not taking excessive pills where you can possibly overdose or go into withdrawal because you're taking too many or too little and you're not having a safe dosage each day. Also, if you're an opiate user, you can also start drug counseling. And the goal of drug counseling is to sort of reframe your thoughts and your ideas, your feelings about your drug use, and also help you to develop coping skills and maybe even life skills so that you can provide a better environment for yourself and your baby after your pregnancy. So let's talk a little bit about the stigma of drug use the stigma of drug use. It's not just while you're pregnant, In America, there's kind of a judgmental punishment type of way that we treat addicts. We treat it more of as a mortal failure versus a disease. So there are some states, I believe I read that maybe it's Tennessee, that have legal consequences for people who are found to be addicts and are pregnant. And that's unfortunate because it actually stops the person from wanting to seek treatment, prenatal care, or even addiction treatment when they're pregnant. So hopefully, you can make a good decision about you can make better decisions, especially when you find out that you're pregnant, about how to go forward. And that's actually the most important thing, because now you have another life that you'll be responsible for. So the best decision you can make is to get treatment for you and your baby. So don't necessarily worry about some of those consequences, because if you're trying to do the best that you can as far as getting treatment so that your baby is safe and you're safe during your pregnancy, then that's all that anyone can really expect from you. And then let everything else just fall as it may. I actually have a lot of pregnant women who are opiate addicts in my clinic, and some of the things that we discuss is that once they deliver the baby, once they find the drugs in their system, which they are currently in medication assisted treatment, that they're going to call CPS and then they have to go through all of that. But my experience is that usually, especially if you're prescribed and your provider can say that you're being treated for your opiate addiction, then they will check the environment. They will check to make sure that you're safely managing your illness, and then you get your baby. So those are the important things. Okay, so this is Dr. Centrell Psych. I'm an adult psychiatrist who focuses on addiction. I help those with psychiatric illnesses and addictive problems find a pathway to recovery. Go to my Facebook page at www.facebook.com/drcyntrell psych and follow me for further information that may help you. Thanks. Bye-bye.